If you have ever tweaked your back just slightly, you are well aware of how debilitating a slight tweak can be. While it goes away for some, others live with that pain for years.
That's right. And many turn to Dr. Miller at Total Health Chiropractic for his non-surgical, non-invasive approach so they can get back to loving life again. Perhaps this pertains to you. Are you that person that's really missing out on things you love because of chronic neck and back pain? Have you gone to a lot of other doctors, chiropractors, and they're just failing you and you feel like you're running out of options? Well, a great one is right here with Dr. Miller at Total Health Chiropractic. I'm joined by Dr. Miller, and of course we're going to get to Rick and his story in just a moment. Thanks so much for being here.
Welcome to our office, Leanne.
Thank you so much. Okay, so the DRX9000, we've heard so much about this, but I really want to dive into what makes this so unique and different from other things that are out there.
Well, most treatments that are offered to patients when they have chronic neck or back pain revolves around symptom relief. You know, doctors are prescribing drugs and medications to mask the symptoms. Other times they'll do shots or injections at pain clinics. You know, the worst case scenario is getting back or neck surgery, but most of the time these treatments are just designed to mask the pain. They're not actually fixing the cause of that pain, and that's a frustrating thing for patients, why they have to keep going back for these treatments over and over again, is they're not really doing anything to fix the problem. And DRX9000 Therapy is actually a medical device that we use in our office to help these same patients that have tried the drugs, the shots, or the surgery with, you know, very minimal results. And it actually helps to heal and regenerate degeneration of the spine and injured discs. So a lot of these patients are struggling with degenerative disc disease, or it may be a bulging or herniated or ruptured disc. And by actually fixing the problem and getting their discs and their spine healthier, that's why they're able to go live a normal life once again and not have to continue on the drugs or the, you know, face the shots or the surgery.
Yeah, let's kind of give people a visual, I guess, of what this is actually doing, because you said it's rehydrating. I mean, that sounds so good to begin with, but kind of explain that process a little bit more and what that's doing to help heal the person.
Sure. So it's a very specific treatment on one individual level at a time, and it gently stretches with the aid of computers, stretches that segment to actually create a vacuum effect within the disc, which will actually draw those herniations back in where they should be and off of the nerves. And if the discs are degenerated and dried out and thinned down, it actually will draw in moisture and nutrients into those discs to rehydrate them and make them thicker once again.
Wonderful. And it's based on a case-by-case basis as far as how many treatments people need and that sort of thing to come in and blend it in with some of your other therapy as well.
Yeah, we try to create a synergy with certain treatments at the right time. You know, we have found it usually takes more than just one treatment to really get the problem fixed. And I know that there's several doctors or chiropractors out there that have some decompression tables, but DRX9000 Therapy is really one of the original decompression units out there, and they've had a lot of studies showing the effectiveness of it, and it uses what's called a logarithmic curve where it interacts with a patient, tricking them into a loose and relaxed state. So it's not pulling very, very strong where they feel like they're going to get injured, where the muscles tense up. It tricks those muscles into a loose and relaxed state so it can separate the vertebrae and change the disc. But the only study that was ever done where they actually inserted a cannula into the disc and measured that drop in discal pressure, they used that logarithmic curve that the DRX9000 uses.
Wonderful. All right, well, we love success stories, and you have Rick sitting right next to you. Let's talk about his condition when he came here, as far as what he was facing.
Sure. Well, he had come in with a lot of chronic low back pain, and you know, I told him we have to find out what the cause of that is. So we did a thorough physical examination on his back and took a couple x-rays. And you know, as I reviewed that with Rick, what we had found was that in the low part of his back, that L5 disc, instead of being thick and squishy like this, had dried out and degenerated more to this range where it had thinned down. That started to encroach on the nerves and cause pain, but also cause a lot of brittleness and stiffness there. And you know, Rick likes to be active and really enjoys life, and you know, by regenerating that disc through DRX9000 Therapy, you know, he's able to get out there and work and do the hobbies and things he likes to do once again.
Wonderful. So Rick, let's go ahead and talk a little bit about your story. As Dr. Miller mentioned, you are somebody that was or are very active, but you had limitations because of your pain.
Yes, I did.
So what was going on with you?
Well, it first started like 6 years ago. I got done discing and I thought I pulled a muscle. So I'm thinking nothing, it's a muscle in my back, you know, it was back pain going down shooting down my leg, it was pain. And about 3 months went by and it went away. So I'm like, okay, it was a pulled muscle, it's older, it takes a while to heal. And so about a year after that, it came back again, and it was back for 3 months and went away, and it came back again. And finally last summer, it came back to where it was just so severe. It wasn't just my back, it was that it made like my left or my right buttocks just throb with pain, and it sent pain all the way down. You feel your knee would throb, and your ankle would throb, and your bones would just hurt. You know, just the whole one side of just terrible. And I was thinking, I'd go down, stretch it out, sometimes it'd get okay, but it just started getting to where it wasn't going away anymore. And aspirin Aleve wasn't doing the trick anymore, so I go, I gotta do something about it. So that's when I came to Dr. Miller, and when I saw the x-rays, I couldn't believe how bad it really looked. And I was like, I didn't think there was hope for me. Yeah. But ever since from day one when I got on that decompression thing, it's like pain's been gone and it's been a lot better. I've been able to be really active. My job is really there good. And
yeah. And because you're an avid disc golf player, and that's the thing, all that twisting, that's such a crucial part of your body, obviously, that, I mean, your back is anyway, but to play disc golf especially.
Oh yeah, a lot of times when I especially go to drive, and also the pain would be there, so you just hang on to the disc as you turn, and just people would be laughing at me because I throw the disc instead of straight, it'd be way to the side of you, and I says, no, I gotta go, the pain's there, you know. Then only thing I could do where I wasn't in pain was my mountain biking. Yeah. That was the only thing I had left to do, but I says, no, I had to finally, because the only thing I saw 6 years ago was a regular doctor. They took x-rays, said nothing was wrong with me then. But then after seeing Dr. Miller, you know, I go, I gotta go do this, because I'm feeling that pain, and I'm glad I came because I'm back to being healthy again. And
so what would you say to someone at home, because obviously you're very young, so what would you say to somebody at home that's in your situation before they let it drag on?
Well, I wouldn't let it drag on. I'm stubborn about doctors, but I'm sure glad I came, because if I'd have let it drag on any longer, my bones would have fused together and I would have been no good anymore. So I'm glad if people just get up and do it, you know, it's worth it. You know, no surgery, no drugs, it's worth it.
And Total Health Chiropractic has a great offer for Morning Mix viewers. If you call their office right now, you'll get a consultation and examination for just $47. And if you're one of the first 3 callers, you'll get a free hydro massage. So call right now, 616-828-0861. And if the lines are busy, just keep calling. Again, that number's right there on the screen, 616-828-0861.